Hello everyone, and welcome. My name is Andrew Mai, and today we're rediving into one of the most exciting frontiers in modern medicine, using your body's own healing power to repair knee pain from osteoarthritis and injuries. For millions of people, chronic knee pain feels like a life sentence. It limits your activities, affects your quality of life, and often leads down the path to major surgery like a knee replacement. But what if there was an alternative? What if we could move beyond temporary fixes and towards true biological regeneration? That's exactly what we're going to talk about today, using a resource your body has in abundance, your own fat tissue. So when we discuss regenerative medicine for knees, we're talking about harvesting your body's own mesenchymal stem cells, or MSCs. For a long time, doctors would get these from bone marrow. But we've made a huge discovery. Your adipose tissue, or fat, is a far superior source. Why fat? First, the sheer quantity. Fat contains hundreds of times more readily available stem cells than bone marrow, especially as we get older. More cells mean a more potent treatment. Second, the harvesting process is much easier. It's a simple mini liposuction, usually done under local anesthesia. It's quicker and less painful than a bone marrow aspiration, with a faster recovery time from the collection itself. Once we have these powerful cells, they are carefully processed and then precisely injected back into your knee, ready to get to work. But here's where it gets really fascinating. How do these cells actually repair the damage? It's not that they magically turn into new cartilage. Instead, they act like a cellular pharmacist and orchestra conductor, directing the healing process. They do this by releasing billions of tiny packages called exosomes. Think of an exosome as a tiny text message sent from the stem cell directly to the injured cells in your knee. These messages are packed with critical instructions. They contain microRNA, which tells your damaged cells to stop dying and start rebuilding. They're filled with powerful anti-inflammatory proteins that immediately work to shut down the chronic pain and swelling. And they carry growth factors, which act like a beacon, calling your knee's own native repair cells to the site of the damage. This is so effective that we're now exploring using exosomes as a therapy all by themselves. They deliver the active ingredients of the stem cell without the cell itself, providing a highly concentrated, targeted, and non-cellular biological therapy. It's all about maximizing those regenerative signals. And whether we use the fat-derived cells or the pure exosomes, the treatment is an investment in your body's future. And protecting that investment is key. The protocol is just as important as the procedure itself. First, we use ultrasound guidance for the injection. This ensures that the high concentration of healing factors gets exactly where it needs to go, whether that's into the joint space or a specific ligament tear. Next, post-procedure care is absolutely crucial. For the first few days, we recommend reducing the pressure on your knee. This prevents the healing factors from being squeezed out of the joint. Most importantly, we ask patients to avoid all NSAID pain relievers, like ibuprofen, for the first few weeks. It might sound counterintuitive, but these drugs block the very inflammatory signals that the cells and exosomes use to find and fix the injury. The healing journey happens in stages. In the first 3 months, you'll typically experience the greatest pain reduction as the anti-inflammatory effects kick in. From 3 to 6 months, we start to see structural improvement as your body deposits a new tissue matrix. And over the course of a year, that new tissue fully integrates and stabilizes, restoring strength and function. This is the future of orthopedic care, regenerative therapy powered by the incredible abundance of your own fat-derived cells. And the pinpoint communication of exosomes offers a powerful, natural solution to rebuild your knee and restore a pain-free, active life. Thank you so much for watching. If you found this information helpful, please hit that like button and subscribe for more content on the future of medicine. See you in the next video.